On this episode, we'll talk about what is a gastric sleeve surgery.
3, 2, 1.
Here we go!
Hi, I'm Dr. Álvarez with Endobariatric.com, and welcome to another episode of our FAQ section. And today I will be talking about something I probably should have done many years ago. So today I noticed that after uploading over 1,300 videos in two languages, English and Spanish, I have not answered the question, what is a gastric sleeve? Blows my mind. So I know if you're here and you are a subscriber to my channel, you already know what a gastric sleeve is. I know if you are researching, you probably already know, but maybe you're new to the channel. Maybe you're new to my information. Maybe you need a reference to send over a link to a family member, to your spouse, to a friend, so they can actually know gastric sleeve surgery is. So let's get into it. So gastric sleeve surgery, also known as sleeve gastrectomy, is a procedure or a surgery, a type of surgery that is that falls into the category of weight loss procedures. So there are several types of weight loss surgeries. This is one of them. The gastric sleeve is a restrictive procedure, which means, and I'll pull out my little plushie toy here from it was a gift from the Brazilian Society on Bariatric and Metabolic Surgery, which thank you again. So this model right here will show that the sleeve gastrectomy, again, it's a type of weight loss procedure. It's purely restrictive, which means that it will restrict the amount of food you intake. There is no malabsorption, there is no malnutrition, intentionally done by the procedure, like the gastric bypass or the duodenal switch, etc. And it is the only procedure that nowadays we have that preserves the entrance of the stomach, preserves the exit of the stomach, and preserves the intestine, because we don't touch the intestine at all. What do we do with this procedure? Well, this procedure removes pretty much about 80% of your stomach and leaves you with this. Again, entrance of the stomach stays untouched. Exit of the stomach, the exit you're born with, it's untouched as well. And you're left with this stomach. That's why it's called a sleeve, because it mimics a sleeve. It mimics a long tube. And it's pretty much sized and shaped as a small banana or a medium-sized banana. And of course, that will vary depending on the patient's original stomach size. So this procedure, as the category explains, it is a restrictive procedure. So again, it will restrict the amount of food you intake, therefore restricting the amount of overall calories you intake in a day, and therefore the rest of the calories your body needs to survive or to thrive or to live will come from your stored fat. That's how you lose weight. This is a permanent procedure, again, and there is another characteristic about this procedure is that there is no foreign body inside you. There's nothing stays inside of you. There's no silicone ring. There's no band. There's no mesh. It's just your own stomach. The stomach you're born with, and that's why I like to call it crafting your sleeve, because this does involve artwork. It does involve tailoring to your needs, and it just makes me a little uncomfortable when I hear a sleeve I had a sleeve done in New York, or I had a sleeve done in the Middle East, or I had a sleeve done over here, because a sleeve does not equal a sleeve. It does involve an artist. It does involve artwork. It does involve craftsmanship into crafting. Number one, analyzing your stomach size, shape. It could be rounded. It could be J-shaped. It could be long. And depending on your needs, for the surgeon to craft that new stomach to your needs. This procedure also involves some hormonal changes, mainly on this portion that we remove. There is a hormone in here called ghrelin, and it's actually peptide. That ghrelin produces head hunger, anxiety to eat. And when we remove it, patients are less hungry, less anxiety to eat, and it is a very big ally, along with the restriction, for you to lose weight and help you alleviate medical conditions like high blood pressure, like diabetes, like sleep apnea. And if you don't have these conditions, well, stay away from them. The gastric sleeve surgery or sleeve gastrectomy procedure is a procedure done worldwide, done laparoscopically, which means it is done through very small incisions, very thin instruments and little cameras that we place into the abdomen, and we're able to craft this procedure, giving the patient the big advantage of a very fast, rapid recovery. These tiny incisions are done in the upper part of the abdomen, and if you would like to know if you qualify for this procedure or what risks are involved in your specific case, I would strongly advise you consult with healthcare professionals, or if you want to head over to my website and click on a free online consultation, I'll be more than happy to assist you. I hope you found this information useful. Click on that subscribe button. That way you don't miss on future episodes. And if you like the content, which I apologize, I did not get this out there sooner, leave me one of these. I really appreciate it. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.